If you suffer from migraines, you know just how debilitating they can be. The throbbing pain, nausea, sensitivity to light and sound. It's a condition that affects millions of people worldwide, often without warning. But what if there was a way to avoid migraines, or at least reduce their frequency and intensity? What if you could avoid the triggers that set off those painful episodes every day? In this video, we're going to dive into the truth about migraines, the common triggers that cause them, and, most importantly, how you can reduce the chances of experiencing a migraine by making simple lifestyle changes. We'll explore actionable tips and strategies you can implement to avoid those triggers daily, allowing you to regain control of your life and reduce the burden of migraines. Understanding migraines. What are they? Before we discuss how to avoid migraines, it's important to understand what they are. A migraine is a neurological condition that often causes intense, pulsating headaches, usually on one side of the head. But migraines aren't just about the pain. They can also come with a range of other symptoms, including nausea or vomiting, sensitivity to light, sound, or smells, visual disturbances, such as seeing auras or flashing lights, dizziness or vertigo, fatigue and difficulty concentrating. Migraines can last anywhere from a few hours to several days and can significantly affect your daily life. While the exact cause of migraines isn't fully understood, they are thought to be triggered by genetic factors, changes in brain chemicals, and environmental factors. The most common migraine triggers. There's no one-size-fits-all when it comes to migraine triggers. What triggers one person's migraine might not affect someone else. However, there are several common triggers that have been identified by both migraine sufferers and researchers. Understanding these triggers can help you avoid them and reduce the likelihood of experiencing a migraine. 1. Stress and emotional triggers. One of the most common triggers for migraines is stress. The body's response to stress can increase levels of cortisol, the stress hormone, and trigger changes in brain activity that lead to a migraine. Anxiety, depression, and intense emotions can also contribute to migraine onset. How to avoid stress as a trigger. Practice relaxation techniques such as deep breathing, yoga, or meditation to reduce stress levels. Consider incorporating mindfulness into your daily routine to help manage emotional triggers. Engage in regular physical activity to reduce stress and increase endorphins, which can act as natural painkillers. 2. Diet and food triggers. Certain foods and drinks are well-known migraine triggers for many people. Common culprits include caffeine. While small amounts of caffeine may help some people, excessive caffeine consumption or withdrawal can trigger migraines. Chocolate contains compounds that can activate migraine pathways in the brain. Alcohol, especially red wine, which contains histamines and tannins that can dilate blood vessels and trigger migraines. Processed foods. Foods high in sodium, preservatives, and artificial additives, like MSG, can cause migraines in some individuals. Aged cheeses, cured meats, and foods containing tyramine, like fermented products, are also frequent triggers. How to manage food-related triggers. Keep a food diary to track what you eat and identify any patterns between certain foods and your migraines. Try eliminating common triggers from your diet for a few weeks and reintroduce them one at a time to see which ones cause issues. Opt for whole, unprocessed foods like fruits, vegetables, whole grains, and lean proteins. 3. Sleep disruptions. Getting too little or too much sleep can both trigger migraines. Migraines can often be linked to changes in your sleep patterns, such as sleep deprivation, irregular sleep schedules, or even oversleeping. How to regulate sleep patterns. Establish a consistent sleep schedule by going to bed and waking up at the same time each day. Aim for 7 to 9 hours of quality sleep per night. Create a calming bedtime routine to help you wind down before sleep, such as reading, taking a warm bath, or practicing relaxation exercises. Avoid electronics, phones, laptops, at least an hour before bed, as the blue light emitted can interfere with sleep. 4. Environmental triggers. Environmental factors can also trigger migraines, and these triggers are often unavoidable but can be managed. Common environmental triggers include bright or flickering lights. Staring at bright lights, fluorescent lights, or even sunlight can provoke a migraine. Strong smells. Perfumes, cleaning products, and smoke can trigger migraines in sensitive individuals. Loud noises. Noise pollution or sudden loud sounds can be migraine-inducing. Weather changes. Sudden shifts in temperature or barometric pressure can trigger migraines in some people. How to avoid environmental triggers. Wear sunglasses or a wide-brimmed hat when outdoors to protect your eyes from bright sunlight. If you're sensitive to smells, try to avoid places with strong odors and consider using essential oils like lavender to calm your senses. Use earplugs in noisy environments or wear noise-cancelling headphones to minimize sound sensitivity. Keep track of weather patterns like temperature or humidity changes to anticipate potential migraine triggers. What happens if you avoid these triggers daily? Now that we know what the common migraine triggers are, the big question is, what if you avoided these triggers every day? Could you reduce or even eliminate your migraines? 1. Reduced frequency and intensity of migraines. By consistently avoiding known triggers, many people find that their migraine frequency and intensity decrease significantly. With fewer migraines, you'll experience fewer days of pain, nausea, and disruption to your daily life. Keeping a migraine diary can help you track how often migraines occur and whether their severity decreases as you avoid triggers. 2. Improved quality of life. Migraine attacks can be disabling, impacting your ability to work, socialize, and perform daily activities. By avoiding triggers, you might find that your quality of life improves with fewer interruptions to your day. You'll feel more energetic, productive, and engaged in activities without the constant worry of when the next migraine will hit. 3. Better long-term health outcomes. Chronic migraines can sometimes lead to depression, anxiety, and other mental health challenges due to the constant pain and disruption they cause. By taking control of your migraines through trigger management, you can reduce the risk of developing associated conditions and enjoy better overall mental and physical health. How to implement trigger avoidance in your daily routine. Implementing daily trigger avoidance for migraines doesn't require drastic changes. It's about adopting healthier habits and making mindful choices. Here's how you can incorporate these strategies into your everyday routine. Track your triggers. Use a journal or an app to log your daily activities, meals, sleep, and environmental conditions to identify your specific migraine triggers. Plan your meals. Avoid common food triggers and opt for nutrient-dense, whole foods that support overall health and reduce inflammation. Create a stress-free environment. Incorporate relaxation techniques, establish a calming routine, and make your living and working spaces migraine-friendly by reducing noise and light exposure. Prioritize sleep. Set up a relaxing evening routine and stick to a consistent sleep schedule to improve sleep quality. Hydrate. Dehydration is another common migraine trigger, so be sure to drink plenty of water throughout the day. Taking control of your migraines. Migraines can be incredibly disruptive, but by avoiding known triggers and adopting lifestyle changes, you can significantly reduce the frequency and severity of your migraines. Managing your diet, sleep, stress, and environmental factors can all play a crucial role in protecting your body from the painful effects of migraines. While avoiding triggers every day might not eliminate all migraines, it can dramatically improve your quality of life, giving you back control and reducing the burden of migraine attacks. Start today by tracking your triggers and making small adjustments in your routine. You might be surprised by how much better you feel. Advanced strategies for managing migraines. While avoiding common triggers can significantly reduce the frequency and severity of your migraines, there are advanced strategies that can further improve your ability to manage migraines and support your overall well-being. These strategies involve long-term lifestyle changes, medical interventions, and alternative therapies that can help you take control of your migraines. Epitomize. Medical treatments and preventive medications. For some individuals, avoiding triggers may not be enough to prevent migraines altogether, especially if the migraines are chronic or severe. In such cases, preventive medications prescribed by a healthcare provider may help reduce the frequency and intensity of migraines. Common preventive treatments include beta blockers, such as propranolol. Often prescribed for high blood pressure, beta blockers have been shown to reduce migraine frequency. Antidepressants, such as amitriptyline. These medications can help prevent migraines by affecting serotonin levels in the brain, which plays a role in migraine development. Anticonvulsants, such as topiramate. Originally used to treat seizures, these medications have been found to be effective in preventing migraines. CGRP inhibitors, such as erenumab. A newer class of medications designed to block the calcitonin gene-related peptide, CGRP, which is involved in the migraine process. If you find that your migraines are frequent or debilitating, it's worth consulting with a neurologist or headache specialist to explore whether these preventative medications might be right for you. 2. Botox injections for chronic migraines. For those who suffer from chronic migraines, defined as having more than 15 days of headaches per month, Botox injections may offer relief. Botox has been FDA approved for the prevention of chronic migraines and can be an effective option for individuals who have not responded to other treatments. How Botox works for migraines. Botox is injected into the muscles around the head, neck, and shoulders to block the release of neurotransmitters involved in the pain process. The injections are typically given every 12 weeks and can significantly reduce the frequency and intensity of migraine attacks. While Botox may seem like an extreme treatment, many people who suffer from chronic migraines find it to be a highly effective option, particularly when other preventive measures have failed. 3. Alternative therapies for migraines. In addition to medical treatments, Several alternative therapies have been shown to help manage migraines. These therapies can be used alongside traditional treatments and may provide additional relief, especially when lifestyle adjustments alone are not enough. Popular alternative therapies for migraine management. Acupuncture. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body. Some studies suggest that acupuncture can help reduce the frequency and intensity of migraines by stimulating the body's natural healing mechanisms and improving circulation. Massage therapy. Regular massages, particularly neck and shoulder massages, can help relieve muscle tension and reduce stress, both of which are common migraine triggers. Massage therapy can also promote relaxation, reducing the intensity of migraines. Chiropractic care. Some individuals find relief from migraines by seeing a chiropractor for spinal adjustments. Chiropractic adjustments, particularly in the neck and upper back, may help alleviate tension and improve overall nervous system function, which could reduce migraine frequency. Biofeedback. This technique teaches you how to control physiological functions like heart rate, muscle tension, and breathing patterns through visual or auditory feedback. Biofeedback has been shown to help reduce migraine severity by teaching relaxation techniques and improving your ability to manage stress. 4. Cognitive behavioral therapy, CBT, for migraines. Cognitive behavioral therapy, CBT, is a type of talk therapy that focuses on changing negative thought patterns and behaviors. CBT is particularly useful for individuals whose migraines are triggered or worsened by stress and anxiety. It helps patients develop coping strategies to manage pain and stress, ultimately reducing the frequency of migraines. How CBT helps with migraines. Stress management. CBT teaches techniques to manage stress, which is a common migraine trigger. Cognitive restructuring. CBT helps you identify and challenge thoughts and beliefs that may contribute to migraine pain or stress. Relaxation techniques. CBT incorporates relaxation techniques such as deep breathing and progressive muscle relaxation to help manage migraine triggers. Many people find that CBT, especially when combined with medication or lifestyle changes, can lead to significant improvements in migraine management. 5. Mindfulness and meditation. Mindfulness practices and meditation can help you manage chronic pain, including migraines. By staying present and focusing on the breath or a calming image, you can reduce stress, calm the nervous system, and prevent the onset of a migraine. How mindfulness and meditation help with migraines. Stress reduction. Meditation helps reduce stress, a key migraine trigger. Increased relaxation. Mindfulness practices help activate the parasympathetic nervous system, which promotes relaxation and reduces the intensity of migraines. Pain management. Research has shown that mindfulness meditation can change the way your brain processes pain, making it more manageable. Starting with 10 to 15 minutes of meditation each day can provide relief over time, and incorporating mindfulness techniques into your daily life can help prevent future migraines. 6. Proper hydration and diet. In addition to avoiding known triggers, staying hydrated and maintaining a healthy diet are critical for preventing migraines. Dehydration is a common trigger for migraines, and certain foods can exacerbate symptoms. Here are some tips to keep your body in balance. Hydration. Drink plenty of water throughout the day, especially during hot weather or after physical activity. Aim for 8 to 10 glasses of water per day to stay hydrated and prevent dehydration-induced migraines. Diet. Focus on a balanced diet that includes whole grains, fruits, vegetables, lean proteins, and healthy fats to keep your blood sugar stable. Avoid processed foods, excessive caffeine, and alcohol, which can all trigger migraines in some individuals. What to expect after avoiding migraines triggers daily. If you make a conscious effort to avoid your migraine triggers daily, here's what you might expect over time. 1. Fewer migraines. As you consistently avoid your triggers, you may experience fewer migraine episodes. Your body will gradually adjust, and you may find that your migraines become less frequent or severe. 2. Less intense symptoms. Even if you do experience a migraine, it may not be as intense or long-lasting if you're taking steps to manage stress, hydrate, and eat a balanced diet. San. Improved quality of life. By reducing the frequency of migraines, you'll be able to enjoy more days without pain or disruptions, improving your overall quality of life. 4. Greater control over your health. With daily attention to managing your migraines, you'll feel more empowered in taking control of your health and well-being. Taking control of your migraines. Migraines can be incredibly debilitating, but with the right strategies in place, you can reduce their frequency and severity. By avoiding common triggers, practicing stress management, making healthy lifestyle changes, and exploring medical and alternative treatments, you can regain control of your health and prevent migraines from controlling your life. Remember, consistency is key. Avoiding triggers daily, along with maintaining a healthy routine, can help you reduce migraines over time. While you may not be able to avoid every trigger or eliminate migraines completely, taking these steps can significantly improve your quality of life and help you live more freely. Thank you for watching, and don't forget to take proactive steps to manage your migraines for a more comfortable, pain-free life.